Rockers in Recovery Media is dedicated to carrying the message of addiction recovery through music, news, events, and festivals taking place within and not limited to the clean and sober community.
Hey, good evening. John Hollis with Rockers in Recovery. Welcome to the show. If you're checking out Rockers in Recovery for the first time, you can check us out at rockersinrecovery.com. Gives you all the information that you would want to know about who we are and what we've been doing for the last 10 years. Started Rockers in Recovery in 2008. And, of course, we are a media company, and we deal with addiction issues, amongst other things. And tonight we are having a show that is going to be an informative and education show, different varieties of ways that you can seek help. And we also have a musical guest that's coming on, Vic Monty from the Crush Band. So we're looking forward to having Vic on with us and having a great show. And tonight we're going to start out with Dr. Michael Ligotti, and he is out of the whole health of Delray Beach, and we're going to get him on the phone. We're going to talk about Hep C. I found out some amazing stuff just reading over the last couple of days on Hep C. Dr. Mike, you with us?
I am here, John. Thank you. Nice to talk to you tonight.
It's very good to have you on the show, and if you could just give a little bit of a breakdown on who you are and what you do, so people understand who you are from your words.
Yeah, absolutely. I'm a double board-certified physician in Delray Beach. Originally board certified in family medicine and addiction medicine as well. And I've been in Delray Beach for about 15 years, treating the recovery community in every capacity, from inpatient detox to sober living, and then on their own in the community. And that's what our office is dedicated to do, is to serve that community.
So here's a news flash for everybody, and especially us baby boomers. 60% of intravenous drug users have Hep C. That's a staggering amount of people. And from what I'm understanding, they're saying that everybody in the baby boomers era should really all be tested. Is that correct?
Yeah, no, that's absolutely correct. And those statistics, I would say, honestly, in my practice, that's right on. It's at least 60% of my patients that are intravenous drug users. And the baby boomers, part of the problem with hepatitis C is, quite frankly, there are modes of transmission that probably remain to be elucidated. I don't know if, these baby boomers have had blood transfusions or shared needles or what the case may be, but there are many people with hepatitis C that really have no idea where they could have contracted it.
And is it sexually transmitted also, correct?
It's kind of a tough question. So in theory, it can be. We definitely would say it can be. It's very rarely in practice sexually transmitted. It's more a function of blood-to-blood transmission. So the more traumatic types of sexual activity, not to be too graphic, would probably be more apt to transmit a virus like that.
Okay. So at this point, when you are dealing with somebody that's just getting clean, they're coming to you and they're in detox and they go through the process of doing all of their blood work and all of those things, do you test for this, or do they have to ask for it to be tested?
Oh, no, absolutely not. It's a formal part of the screening of all of our patients.
Okay. So what happens at the point where a person, is doing all of your, blood work and going through the process, and they find out that not only they're dealing with their own addiction issues, but now they have Hep C? I'm sure there's got to be fear and anxiety, and things that, could actually be detrimental to them staying put. They want to run. I know how I was. Anytime fear came up, I wanted to run.
Absolutely, that's absolutely a big part of it, and definitely something we can contend with. And then the other part is trying to figure out, frankly, the right time to initiate treatment, because the treatment, the new cutting-edge treatment with these medications like Harvoni and Epclusa, and these basically one pill a day for 3 months medications with minimal side effects. It's not like the old days with ribavirin, interferon that had debilitating side effects and kind of, negligible success. These new medications are like 95% successful, and we're calling it a cure. And the problem is, though, that they're extraordinarily expensive. It could be $50,000 to $100,000 for these medicines. And the reason I bring that up is if somebody is, clean, at that point, do we initiate that treatment? And the insurance companies kind of balk at that. And they say, this kid's a month clean, and he or she has a history of chronic recidivism, and the likelihood of he or she getting re-exposed to Hep C after we pay for all this medicine is very high. And so it's really a tough situation, to be honest with you.
I understand that you have a program that you're helping people with Hep C, and can you give us a little bit of details on that and how that Hep C program works within your program?
Yeah, absolutely. At our office in Delray Beach at Whole Health, we have our own lab for blood work and things of that nature. So we basically can do all of the not only hepatitis C, but primary care blood work, such as blood counts and chemistries and cholesterol, thyroid testing, and sexually transmitted diseases, and hormone testing, and anything that might be applicable. But in amongst that is the hepatitis C antibody testing and the viral load and genotype that we can do right on site. In addition to that, I purchased something called a FibroScan machine, which actually stages the extent that the liver has been damaged by the virus. And this is something that's required by a lot of insurers in order to cover the medication. So the long story short is we have everything under our roof at Whole Health to provide for the effective diagnosis and basically triaging of these patients to either get the insurance, if they have insurance, to get them to pay for the medication. But other than that, we actually worked with a pharmaceutical company that can get the patient scholarshiped for the medication. So we can take in a limited, obviously everything has expense and overhead, but we can take in a limited amount of scholarship patients where we can do the blood work and the FibroScan and everything at no cost to the patient because they're indigent or they have no insurance and they have no means to pay. And then I can get them scholarship for the medication. So it's like giving somebody a $50,000 gift and curing them of their hepatitis C. So we're very proud of that.
So that's an amazing thing, and that's a lot of giving back to the community. That's what it's all about. As a private practice, an urgent care and a drug treatment in Delray Beach, do you find that your family practice that you have, a family practice where you're dealing with kids and adults, and then you see as time goes by, somebody might end up with an issue, and they already have somebody like you at their disposal that parents can come to and talk to and find out more information to help their kids?
Absolutely. And what I find is I think what is reality across our entire country, unfortunately, and that's that every family, whether they be my so-called normal patients, Medicare age patients, families in Delray Beach, every family has been touched by this disease, and to a certain extent, and it can be a personal issue, it can be a child's issue, a father or mother's issue, but everybody can relate to it. And I honestly have that dialogue with my so-called normal patients. I hate to use that term, but I think the spirit with which I mean it. But I have that dialogue more often than not, quite frankly.
Here you have, the addiction treatment aspect of it. Let's look at that. We've talked about Hep C. Let's talk about the treatment aspect of it. You deal with a lot of opioid clients and a lot of opioid addicts and people that are trying to turn their lives around. Now, there are this organization and fundamental thought that you shouldn't be treating addiction with medication. Or if you're treating addiction with a medication, you're really not clean. And that being said, what are your feelings on those types of comments?
Yeah, this is a topic that I really could speak all night on, and I'm so passionate about. And honestly, let me start by saying that the whole spirit of medicine, whatever disease we're dealing with, I don't care if it's diabetes, heart disease, addiction, cancer, the whole spirit of medicine is individualized treatment. And that involves a physician sitting down, speaking to a patient, and coming up with a game plan. And that game plan is never the same for any given patient. Just like all my diabetic patients are not on the same medications, and all my hypertensive patients are not on the same blood pressure medications, all my patients with a substance use disorder are not on the same medications. And, I don't know how to stress that enough. And we have this abstinence-based population in the recovery community that, sit there even to this day after 60,000 kids died last year and are thumping their big book saying 12 steps is the only way to get clean and MAT is not being clean and Suboxone is evil. And listen, man, I think we need to redefine success. And to me, success, the first success is my patient is alive. Okay, that's my first success. So if these abstinence-based treatment centers want to brag about their single-digit success rates with their opiate use disorder clients, I mean, they're free to do so. I just don't see it. I mean, again, 60,000 kids died last year, and they're still screaming about, abstinence is the only way to go. And these kids are dying. So I don't know as a physician how, again, with any chronic disease, there is a medication component and there's a behavioral component. If I have a 400-pound diabetic patient, I may give him insulin and cholesterol medicine, blood pressure medicine, but I'm also counseling him on diet, exercise, weight loss, and things like that. But I don't say, listen, you're 400 pounds, lazy, go exercise, go lose weight. I'm not giving you your medication. It's a combined approach, and the chronic disease of addiction is no different. There's a behavioral component, which is what this whole residential PHP, IOP, OP, NAAA, all of that stuff is based on. But there's absolutely a medical component and a medication component to this disease. And, as long as the community continues to shun that and not have an open mind, and there are reasons for that we could get into if you like, as long as they continue to do that, there's going to be, increasing morbidity and mortality in this population.
Something, Doc, what we're going to do, because we are coming towards the end of the segment, and what I want to do is bring you back, because I think there's a whole lot we need to talk about. So
my pleasure.
I think that this could be, a 2 or 3 or 4 interview thing here that we're dealing with. And I believe that the information from both sides needs to be discussed, and people need to come to understand that there are, it's not a cookie-cutter approach. Everybody's individualized. And, I'm going to leave it with that. In closing, what would you say to anybody that might be out there that needs help, that might be looking for help, or a family member looking for help for a loved one?
I would say get help immediately. And, especially in the case of opiate use disorder, unfortunately, all these patients are quite literally one use at any given time away from death, and it's that simple. Get help immediately.
And it's Dr. Ligotti, and that's LIGOTTI.com, drligotti.com. And you can also reach Dr. Ligotti by calling 855-636-9242. Offices in Delray Beach, and please make sure that you check out the Rockers in Recovery page, because we just put up 2 blogs. One is from, of course, the doc, and he wrote it on Hep C. Please check that out. It's the second blog from the top of our blog, so you can check that out and click on it, go right to his site also that way, and find out more information. So, Doc, we thank you for being on tonight. We look forward to having you back with us, and we're really, really thrilled about having you also at our festival, which is coming up on November 10th and 11th. We're looking forward to having you there.
Absolutely. I'm looking forward to it as well. Thank you, brother. I appreciate it.
No problem, man. And we look forward to talking to you soon.
Sounds great, John. Have a wonderful night. Thank you.
You too. Bye-bye.
All right. Bye-bye.
just shake your head. You can't believe all the lies are true. All the ghosts of the past, baby, they're still haunting you. But now you ask me why I wanna break your heart. Well, you asking me why, baby, why would I break your heart? I don't know why you're asking me, 'cause you knew the answer from the start, darling. You see, I gotta change my ways. That's what you want from me. Change my ways. That's what you want from me. Can I change something that I just don't see? How can I change my ways? My love, girl, I wanna be your man, baby. I'm gonna show you what I made of. Hell, I'm gonna shed this skin. I'm gonna rise above. Yeah, you see, I'm gonna change my ways. What you want from me? Change my ways. That's what you want from me. But how can I change something that I just don't see? How can I change my ways?
Hey, Tim Ryan here with the Amethyst Recovery Foundation. Just got in from Arkansas. Want to let you know, Rockers in Recovery is having a big event November 11th at the 101 Club in Pompano Beach, Florida. Going to have a ton of music, fellowship. I have the opportunity to come down. I get to speak, share a little bit of hope. really excited about this event. So if you are in the Florida area, Palm Beach down to Miami, Lake Worth, whatever, head to the 101 Club. Starts at 2 in the afternoon, $10 entrance fee. Come on in, share some fellowship. Again, I will be speaking there. Really honored to be able to come in and be a part of this. If you want to follow me, you can check us out on Facebook, From Dope to Hope, or check out our foundation, www.amirf.org. Or for my full-time career, I'm a National Outreach Director for Transformations Treatment Center out of Delray Beach. We will also be a sponsor for this event. Look forward to seeing you then. Have a great day.
Rockers in Recovery Radio is based on opinion only and is not meant to treat or diagnose any health or mental health issue of any kind. If you feel you need help for any health-related issues, please contact a physician or mental health professional. The opinions expressed by our guests are not necessarily those of Rockers in Recovery.
Judy was boring.
Hello.
Then Judy discovered ChumbaCasino.com.
It's my little escape.
Now Judy's the life of the party.
Oh, baby, mama's bringing home the bacon.
Whoa, take it easy, Judy. The Chumba life is for everybody. So go to ChumbaCasino.com and play over 100 casino-style games. Join today and play for free for your chance to redeem some serious prizes. ChumbaCasino.com. No purchase necessary. Void where prohibited by law. 18+ terms and conditions apply. See website for details.